The Department of Health received a total budget allocation of 64.5 billion rand for the 2022-2023 financial year. It says 86% of that, or just around 55 billion rand, will be transferred to the provinces as conditional grants to support various activities such as HIV and AIDS as well as TB programs. Minister Joe Pahla says that government is concerned about over 2 million people who should be on HIV treatment but are not. Let's talk about this with Anele Yawa from the Treatment Action Campaign. Anele, good to have you on the program as always. So 2 million plus people who should be getting their ARV treatment at the moment are not. Were you, as the TAC, surprised to hear that number yesterday?
Greetings to you, Tembegile, and the viewers at home. As TAC, we are not surprised about this number. This number has been there before the COVID-19. That's why as TAC we have been calling for treatment for all, so that even those people who are living with HIV and who are not yet initiated on treatment can be initiated on treatment. Because you will remember, Tembegile, that people who are living with HIV, they become immunocompromised. So in times of COVID, people living with HIV who are not on treatment, they become vulnerable to a number of illnesses, including COVID. It is against that reason where we said as TAC and other progressive forces to our government, can you integrate services for HIV, TB and COVID so that we make sure that no one is left out. So we are not surprised about these numbers, but also we need to ask ourselves if we've got, like for instance in South Africa, we've got an estimated number of 80 million people who are on treatment. About 5.4 million people are estimated to be on treatment, and about 2.6 million are not yet initiated. But what does it mean in terms of the infection? It is estimated, according to 2020 report, it was estimated that about 230 people are getting infected of HIV on a yearly basis. So what does that mean? It means that people who are living with HIV and who are not yet initiated on treatment will be left to die of COVID or of opportunistic infections that are related to HIV. And we are calling upon our government to say this cannot be accepted. This number is not enough. We need to increase the number of people that we are targeting to initiate on treatment.
What do you know to be the reasons why people may not, who should be on ARVs under the current rules, would not be receiving their medication? Is it that people do not present at clinics and hospitals, or do they not know where to go?
There are a number of contributing factors, Tembegile. I will just remind you and the viewers at home, if we remember, during the hard lockdown, HIV and TB services were not provided in our clinics because our priority was to respond to COVID-19. It therefore means those people who presented themselves to our clinics to be tested for HIV, they didn't receive those services. But in the same breath, you will remember, in the same year, the National Department of Health agreed with Treasury that a certain portion from the conditional grant on HIV, TB and malaria must be shifted to respond to COVID-19. We must ask ourselves, what was that money meant for? That money was meant for prevention interventions like buying condoms, education and awareness in our communities. And those programs were never implemented during that time. And also in that process, there are a number of people who were on ARVs that we lost. And then it means, therefore, now we still need to go back and trace and track those people that we lost in that process so that we can link them back to care, whilst we are also trying to initiate those that are not yet initiated on treatment. So there are a number of contributing factors, but in the main, it is around budget as well as making sure that we integrate services of HIV, TB and COVID in order for us to ensure that we don't continue to pay lip service on things like no one is left behind. Okay. We need to make sure that we practicalize that.
So the Tembisa model, which a stat you referenced earlier, 8 million or so people in South Africa are said to have been HIV positive last year, 2021, right? That's a prevalence rate of 13.4% or so. That's on the Tembisa model. I wonder how accurate our data has become over the years as far as making sure that we're aware of everyone who's HIV positive in order that treatment where it's most needed is able to be made available?
We trust the authenticity of this report because it is conducted by people with a credible history. And also the other thing that we are saying is that as the country at the present moment, we are not yet sure how many people who were on ARV treatment that we have lost during this time. So that's why now we are saying, as much as we see the number of people that are on treatment, the number of people who are not yet initiated, we need to know how many people out of this 5.4 million that we have dropped from 2020 until now, so that we don't only look at this 2 million, yet there is another number of people who were on treatment that we are not covering in this process.
Anele,
so we trust the...
Apologies, I didn't mean to cut you off there. Thank you very much for your time. Anele Yawa from the Treatment Action Campaign. Thank you for being with us this afternoon.